It's such an honor to be here to talk about biosecurity. This is one of my favorite topics to talk about in terms of client education. And if I have the time, I'll probably sit here for 2 days to talk about biosecurity like nonstop. But for the interest of time, I'm going to focus on things that I see from my day-to-day practice, how biosecurity is being practiced and how important biosecurity is. And I think avian influenza, with the recent outbreak, it has, of course, there's a lot of sad stories and lots of stress, like lots of burdens that are given to us, not only to poultry practitioners, but also commercial growers and you guys as well as small flock poultry owners. But I think there's so much like merits and things that we can learn from this experience, especially it's a great time to talk about biosecurity in general. I pull out this presentation, this particular slide as a first slide of my presentation. This is a survey that was done in 2 main poultry lab in the States between, I think, 2004 to 2001 to 2014. So they had tabulated all the diseases that they have seen, they're submitted to the labs in small flock poultry. And not surprisingly, that we find that over 50% of these diseases, like look at avian leukosis, fowl pox, ILT, bronchitis, and anything like pests, like worms, mites. Those are diseases that are very commonly found that are easily spread from one flock to another. So that's brings to a point that where biosecurity, it's not today's topic. It's not only for avian influenza, but there's so many diseases that can be prevented by implementing good biosecurity practice from a day-to-day basis. So I am going to start with my first case, which I call small flock A, and these are real cases. This is a hobby farm with approximately 30 layer roosters, so mixed breed and age, very common practice in small flock poultry. Presented problem in multiple flocks, depression, labored breathing, some of the birds were sneezing and having reduced egg production. So one thing the owner did really well was they were able to recognize the signs right away and has a sixth sense that something is abnormal. So they bought some birds to the Animal Health Center in Abbotsford to perform a postmortem exam. And I got the case as a phone consultation and received a reported email from the flock grower. And this is one of my most memorable cases. This is one of the first case that I had when I first started seeing small flock. And it's definitely, you can see here from the report, it's all the scary things that you do not want to see in a small flock poultry, but you're seeing all of them from just one flock. Mycoplasma, they also had infectious coryza and ILT isolated. So these are really highly contagious diseases that are commonly found in small flock and causes respiratory signs. And usually when I do consult on cases, talk to owner, make an accurate diagnosis, the next thing, or sometimes even the first thing, is to get some history. So what happened? This is, and I want to put this out for everyone's knowledge. It's not trying to embarrass anyone or, make light of the situation, but I think this is a very important learning opportunity for every grower. So this particular case, there are definitely some red flags that we can also already see from like some of the history where it created a higher risk for a contagious disease to be in a flock. So things like birds were purchased from multiple sources over the last 6 months. Their most recent purchase was 2 weeks prior to the clinical signs showing up, was from a live animal auction. At the time when they purchased the birds looked healthy, but that's why they were introduced to the existing flock right away. So the client didn't think that the birds were showing any clinical signs. Unfortunately, the clinical signs started to show within the 2 weeks in new birds that were brought in and also existing birds. And this brings to a very important point. about quarantine. So anytime that new birds are entering an existing flock, so it doesn't matter when we talk about newly purchased birds, including fertilized eggs, I'm going to talk more about that later, or birds that returning from another location, for example, poultry show, birds that escape and return, sometimes we forgot about them. Some of the birds are really good. I see, especially in pigeon cases, they're very good at escaping, and then they go missing for a couple of days and come back. And these birds, don't forget that they also have a potential to bring in pathogens from the outside upon their return. And even though they look healthy, lots of cases is many of the diseases, especially like mycoplasma, infectious coryza, IoT, which is a virus, they can stay in the birds for a very long time and not show any clinical signs. So these are the asymptomatic carrier. Some viruses, some pathogens, they can also stay on the feathers, like on the skin of the birds, and they become mechanical carrier. So this is why it's very important, even if you get birds from a reputable source, from a hatch, from a CFI regulated hatchery even, I would recommend, like, can't stress more about the importance of quarantine. So meaning that having the flock completely isolated from your existing flock. Some examples of not proper quarantine. So these are some cases where I see clients reported, oh, they were quarantined, they were isolated from the other flock. But in fact, when you go visit on the farm or get pictures from them, you can see birds that are able to contact each another. They can sneeze like right on another bird's face or pick up droppings. So these are some of the cases that are not proper isolation. My recommendation is to have a quarantine area, or sometimes I call hospitalization area. So this is the area where you can pre-mate, like on your premise, that you can put birds in temporarily that are completely isolated from your existing flock. So the quarantine area can be something very simple. If you have the resources, the space, and the investment to do it, having a complete separate coop as far as away as your original coop would be very helpful. But if you don't, I have clients that have some very creative idea where they have, obviously smaller chicks would be easier. They have this plastic storage unit they put aside in their garage where they're not sharing the same airspace as the other birds. Those would be very helpful. If you have 1 or 2 birds that are sick temporarily and you want to isolate them and hospitalize them temporarily, large size dog kennels, dog crates, they're easy to clean, and they can be tuck away as far away as your existing flock as possible. Those resources would be very helpful. So those are some practical examples. Make sure to keep in mind about the tools, the equipment. Those would be your wheelbarrow and your feeder, drinker. Make sure to have everything separated, and most importantly, yourself too, because you're the person who has the most contact in between different flocks. I would start with, the common sense, what the healthiest flock and the youngest flock possible, and make sure you wear a full personal protective equipment, which I'm going to talk more about it later. And going back to this case, and many cases that I see, I always emphasize how important it is for clients when they acquire new birds to ask questions. You have all the right to ask questions. And if anything that doesn't sound correct or doesn't sound biosecure to you, I would probably reject that flock like coming into your care. So ask questions like disease history of the originated flock. If they are bred on farm, like was there any clinical symptoms from the breeders, any unexplained mortality? So those would be the one that not, take out from a predators that has obvious explanation, but any high unexplained mortality. Sources, like where are they coming from? Did they have like any travel history? Did they do proper quarantine protocols upon birds coming back? And then vaccinations, medication, deworming histories, those are the ones that are very helpful. So don't be afraid to ask questions where the birds are coming from. So our second case, I call this a small flock B. It's a hobby farm with 70 layers of mixed breed and age. And most of them, they were actually hatched on the farm. And the clinical sign was only one bird. This is a bird that I got the picture from, had a swollen eye. So we can see very significant swelling around the eye and also the sinus. So before this client called me, she has done a couple great things that we should learn from. So she, as I mentioned, she isolated the birds right away. She actually have 2 separate hospitalization pen ready that are set up from far away from the flock. So that's already came into her design before she even thought about having chickens. So that's always something that very helpful. And she's a very dedicated owner, like many of you guys, I'm sure. And she inspects like every birds in the flock for clinical symptoms like pretty much every day. So isolation, self-quarantine practices like that should start as soon as you have any suspicious, even when there's subtle clinical signs were observed. One way to, sometimes it's very disheartening to hear, because oftentimes like birds, avian, especially chickens, they're evolutionary, they're prey species. So they have the tendency to hide clinical signs. So I often hear that clients like, blame themselves, like, I should have noticed that earlier, but you can't. Like birds are just, they're instinctively, they hide their signs. So sometimes it's very, very difficult to catch the fact that they're looking sick. So this is why it's very important to keep some other good record. Clinical signs, obviously, I'm going to talk more about that in the next couple of slides. But other than how the birds behave, other than the obvious like clinical signs like sneezing, birds like flipping over, having walking issue, there are other subtle signs that may also give very valuable first-hand information of how the flock is performing, especially when you have a larger number of flocks. For example, egg production, shell quality. So if you're seeing, if you have a layer flock that has all of a sudden poor shell quality, the shells are very thin, sometimes like wrinkle shells that happen, or no shells, those would be some of the first clinical signs that you will observe, because birds devote a lot of energy into egg production. And if they're not feeling well, the egg production site function will definitely be compromised. Weight gain, it's practical for a smaller flock size. I have clients that have 6 to 10 birds, like she would routinely weight her birds, but don't drive yourself crazy. You don't necessarily have to do that every single day. I would say every 2 weeks, like 2 months would be something that's very reasonable, especially when you're suspecting something going wrong with the birds. Pullets, chicks, they should be steadily gaining size and gaining weight day to day. So that would be another sign to watch for. Obviously, your mortality record, any unexplained mortality, and with larger production, you'll be able to track any feed and water intake differently. So learning some of the warning signs of infectious birds diseases would be very helpful. Most of you guys, I hope most of you guys are dealing with very healthy flock. So if you guys are not experienced with how to identify like birds that are sick, I'm gonna bring up a couple pointers to how to look for some subtle signs. There's 2 pictures here on the left. You'll see, I'll take out my pointer. You'll see this bird, very lethargy, in a hunch posture. The eyes, like sometimes they're completely closed or partially closed. So a bird that kind of looks sleepy. So these are some signs of lethargic and also depression. A comb color is often another sign that can tell you more information. Sometimes they look smaller, sometimes they look pale, sometimes they look like they're shrink, like more of a sign of dehydration. Compared to a healthy looking bird, the feathers are more messy, more ruffles. Either they're cold or they didn't really spend a lot of time preening themselves as they should. Droopy tails, droopy wings, those are some of the common signs to look for. And sometimes the signs would be as subtle as I walk into the barn and all the birds come to me, but there's one bird that sit in the corner, or one bird's that not very responsive, where or where the birds were usually very responsive or love to approach and very friendly. So subtle behavior changes like that. Respiratory signs like sneezing, watery eyes, coughing, those are some of the common signs that I see, especially in Mycoplasma and also infectious coryza cases. And I want to share some of the examples. This is on the left. This is a video that I have. I'm just gonna start this video. So with this bird, like from the first glance, it's very difficult to tell this bird has like clinical signs. But when you look closer, this bird actually did do a sneeze. Like, I don't know if any of you guys notice it. And then you can also see that before the sneezing, she actually did a couple of rapid swallowing actions. I'm gonna see if I can play that again. So I'm gonna play that again. So you can see the swallowing here, and then that very rapid sneeze. Stop that. And that's a very clear signs that the birds are having respiratory symptoms. However, sometimes it's very subtle. Sometimes I will hear clients say, hey, I hear a snake, or I hear a change of vocalization, but I don't know which bird is doing it because they're not doing it as frequent. So that's what these are. So some other signs to look for would be check. I'm trying to stop this video, sorry. Okay, sometimes would be to check around the eye, on the face. If any birds are having watery discharge, which is a common symptoms when they have a sinus infection or upper respiratory infection, they'll have a lot of clear watery discharge. Sometimes like you'll see like pus-like discharge as well. And oftentimes it looks like very dirty. It just looks like the face very, very dirty. So that's some of the first sign to look for. Some other signs would be around the nares, so that's their nostril. If they have any nasal discharge, and oftentimes you'll see a crusty buildup. And this is another sign that I like to look for when I go into a flock with, for example, like 5,000 or 10,000 birds. Usually I look for the birds that has dirty neck feathers. So why, well, you can get, one of the reasons why we look for like dirty neck feathers, especially in the subtle signs, is when birds have discharge from their nose, like from the eyes, sometimes they like to clear it up. So they will kind of rub their beak and rub their eyes like on the neck. So if you're seeing a flock like with lots of like dirty neck feathers or feathers like sticking up, that might be a sign, a clue that telling you that they may have like more watery discharge and eye discharge. And these are very obvious, like lots of growers are very good at recognizing signs like swollen sinuses. This is the turkey, and foamy eye discharge are some of the common signs to look for. Pale face, so look on the skin would be very helpful. Oftentimes it's the non-feathered skin that will tell us a lot of information, because another thing with chickens especially is they have lots of feathers, and oftentimes they can hide external lesions. So pale face, comb wattles. The picture on the left here, I don't know if you guys can see the picture, it has like a tinge of yellow. So this chicken actually had some liver condition when we did a necropsy. So having some icterate signs. The middle picture, it's a pox virus case where commonly we see lesions like on non-feathered skin. And then the chick picture is a picture that you may be able to pick up. The wing area, it's very red. It kind of has like this pinkish looking, this chick actually has avian chick anemia, where it causes skin problems. So there's lots of dermatitis, like there are fluid oozing out from the skin and causing the lesion that we look in this picture. And of course, more concern would be some neurological symptoms. So birds that are having problem lifting their wings up, like their wings are very droopy, and also birds that have twisted neck, or they die in a very weird angle with their neck and circling. Those are some evidence of neurological signs that warrant some further investigation. And of course, loose droppings, diarrhea. If it's an individual bird's problem, I don't worry about contagious disease as much as when I'm seeing multiple birds in the flock, like showing similar symptoms. If you can't find, especially when birds are outside in the pasture most of the time in backyard flock, it's really hard to pick up how the fecal dropping looks. So looking at their vent, if their vent feathers are very soiled, like has a lot of dirt, or has shavings stick around it, that would be a sign of them having some chronic loose droppings. And Dr. Thompson shares some pictures of avian influenza cases, and I just want to share a couple of them that came to our practice this year. So this is the one that I think it's actually one of the first cases in BC in a commercial flock, and this is external findings of high-path avian influenza that brought into our practice. These are some 30 plus days broiler chickens with a very high mortality. And even from the look of the external lesion of the bird, you can see compared to a normal chicken, if you guys have seen them before, they should be, their feather colors, their skin color is very congested. So it's very red. And then look at the right picture here, that's their shank, and then the area between their digits, it's what we call it's hemorrhagic. So it has this like pinkish color. These birds almost look like, I don't know if you guys are familiar that in BC, we had a heat dome last year in the end of June. So lots of these birds looks like the birds that were submitted like throughout the heat dome that died from overheating. They pretty much look like a cocoa bird. Like the signs were very dramatic, but obviously in this case, like the history doesn't fit. And the reason why these birds are showing such lesions is because avian influenza causes viremia and causes high fever in birds. So they actually, like before they die, they had like a very high temperature. And that's the head that I took the picture from. Broiler chicken with high-path avian influenza, very congested. And you can see even with the conjunctiva, the eye here, it's very red, very swollen compared to a relatively normal picture here on the right side. So back to our case, before she gave me a call, she isolated her birds right away. That was really good job. One of the other things that this particular client did that I have to give kudos to is she called her friend right away. So this particular client, other than breeding some flocks of her own, she also occasionally shared her fertilized egg to her friends in Alberta. So she called her friends right away and let her know to either destroy or isolate the eggs or the newly hatched chicks until the diagnosis is confirmed. So don't forget about, it's not only the live birds that can transmit diseases, fertilized eggs can also transmit diseases, especially things like mycoplasma. They can be transmitted inside like the egg, but also the outside like the shell. It's definitely a very great environment for some pathogens to survive and transmit. And so don't forget, cleaning your incubator, your hatcher, they should definitely be a part of your cleaning and disinfection checklist, and also a part of the contact tracing. So this is where the visitor log comes into very handy. Make sure that anyone, especially people that has a avian contact, they should be notified like right away. they should be told to monitor clinical signs and practice enhanced cleaning and sanitation until the diagnosis is made. One thing that I always tell my client is you are the police for your flock. So they can't speak, right? So you're basically you're their security, you're their guardian. It's very important to restrict visitors. So ask questions. Again, very important. The avian contact history, whether they have their own birds. I would definitely not encourage anyone that have their own birds to visit another flock that has to visit another flock in another premise. Those are definitely some high risk activity. Always have, if you have visitors that you can avoid, always have a spare personal protective equipment available. So these include like footwear, gloves, cover-on hairnet, and also one set of PPE for each flock. So not one set that goes through like multiple flock, especially if you have a multi-age, multi-species and breed flock on your premise. So set your own boundaries, very important. I have lots of questions about food bath. My comments on food bath is I will try to avoid them if I can't. I don't usually recommend a food bath. Don't get me wrong, they can be very good resources. However, food bath, it's really difficult to maintain. So whenever it's contaminated with organic matters like feces, feathers, like the disinfectants can definitely be deactivated and losing like the proper purpose. So I find having rubber boots designated for particular flocks, those would be very helpful. These disposable plastic booties cover, these are the ones that I commonly use for field calls. It's a one-time use. They're very inexpensive and they're very easy to store. So that those would be the ones that if you expecting once in a while you're going to have visitors like come to your flock, those are the ones that it's very useful to use. But for your day-to-day practice, I would say have a designated pair of rubber boots. Like that will go a long way compared to a food bath that can be easily contaminated. And I put this picture here, and I want to circle right here. This is a picture of actually my foot after I visited a turkey farm, and these are some turkey droppings on my coverall. And this is why it's very important. Don't forget the rest of your body. So having booty is sometimes you can see a very clear example. It's not enough. So having gloves, like having overall hair nets, those would be very useful. And don't forget about the proper C&D when returning from high-risk locations. So any poultry shows, I know Yukons, they have very nice like wildlife reserves too, zoo, other places where you will meet other poultry owner and they have their footwears like on, or their truck, their tools on the premise, like feed stores, live auctions, those would be the high-risk area. So don't forget about changing clothes and putting on designated PPE when you return from those places. Another questions that I get very often is, what is the best coop design for my flock? There's definitely a lot of variety, especially in small flock setting and hobby farms. There's lots of different options. The bottom line is to get a physical barrier and have all the boundaries secure. So having fences, like those would be very important. And having a regular routine inspection, that will come a very long way too, because you're not only setting boundaries for humans, but also unwanted visitors like rodents, like those are some of the very common small animals that we can find. This is a picture in the middle that I took from a coop where I wish I took a video. I forgot to do that when I was on farm. There was actually a family of mice moving back and forth like this cracks, and you can see they were trying to seal it, but the seal wear off. So regular inspections, that would be very helpful. These are some of the good examples, pictures again from my clients, and how they secure the base of the fence line and deter wildlife. For example, you can see the picture on the left. I have this arrow on the left corner here, and they have this mesh wire that is that was installed very deep down, like into the ground. So some of the creatures like raccoons, badgers, they're very good at digging. So those would be very helpful examples. And don't forget about very tiny vehicles that can bring diseases to your flock. So these would be your duckling beetles, the poultry mites. They are actually known mechanical factors for pathogens. Like, for example, they are known like to carry E. coli, they're known to carry salmonella, like bacteria from one flock or another. So making the environment not habitable for them would be one of the important strategies. For example, like duckling beetles, mites, they love living in cracks and crevices. So seal them, like those would be very helpful. And establish a comprehensive integrated pest management plan. Like, don't only rely on insecticide, but rely on like strategies, as I mentioned, like seal cracks and crevices, like not have like spillage of food everywhere. Those would be very helpful. And of course, like other mechanical factors, like your animals, your dogs. I put this out for anyone who loves like science and want to know more about particularly like bacteria, like how long they stay in an environment. This is a really cool research experiment that they did, and it was published in the Journal of Avian Pathology in 1994. So what they did was they took a very common respiratory pathogen in chickens, which is Mycoplasma gallisepticum, like MG, and they put on different type of surfaces, and they study how long the bacteria stay on different type of material and different type of surfaces. And you can see like cotton, like stay on the MG is able to stay for 4 days, able to stay on someone's nose in 1 day, hair on 3 days, even like the feet like for a couple hours. And this tells us why it's very important to stop all the mechanical factors. So not only the birds, not only like the feces, the feathers, but also everything in their environment. They do play a very important role in disease transmission. This is another great example I want to share. Something would be very helpful is this is a farm in Abbotsford, and sometimes when I run into good practice, I like to take a picture to share too. So they do have signs like right at their gate, but they also provided disinfectant for us to disinfect their vehicles upon entering the farm. So some good practices to follow. And don't forget about having clean and disinfect farm equipment. I strongly do not recommend anyone sharing any farm equipment, but I know sometimes it's not practical. If you really, really have to do so, make sure they're properly clean and disinfected. And this would be things like your wheelbarrow, your gardening tools too, especially if you're working in your pasture where the birds usually roam around. And this is an example that's a crate that from the outside, it looks like very clean, but when you look closer, there's actually fecal droppings that hasn't been cleaned out properly. So things that should be paying attention to. This is one of my favorite picture, again, from one of my clients that I did a field call to, a small flock client. Not because the chicken coop's probably nicer than the house that I live in, but also look at all the arrows that I'm pointing to. First of all, the red arrow, you see all the gates, and the fences that are very well established. But look at the yellow arrows here that I'm pointing to. I don't know if you guys can see it very clearly from your screen. So these are lines like here. So what they were actually some galvanized wire rope. I think they have another name called aircraft wires too. So they were placed 1 foot apart by this client. They were attached on both sides of the fences. And it was very helpful to deter all the swooping predator birds. So like those eagles, like hawk, because of the the physical barrier here, they couldn't get down to get to the birds. So one strategy is that would be very helpful and very practical. If you don't have a very big space, if you have some smaller confined area, this is a very cheap, doable, practical option to deter some of the wild birds in your area. And of course, like regular inspections, tree branches that stick out like to your coop, to your pasture area, those are definitely high-risk places where wild birds can set up a nest, they can perch, they can drop feces like down to the pasture. And for those of you who ultimately cannot, I know sometimes I get questions where I have too many birds, it's impossible for me to overcrowd them in an indoor area. If there's no other options that you have to let the birds out, before you let the birds out, do a thorough inspection on the field, like for wildlife mortalities. For example, this is a Canadian geese that I found just the other day in the park, and also try to get rid of the feces like as much as possible, or have things like cover them. So those are some of the strategies that can be helpful and practical in certain situations. Open water sources, as I think Dr. Thompson's mentioned, they attract wildlife, they can harbor pathogens, and it's really impossible to keep clean. So it would be very helpful to cover up all the puddles like of water versus a closed water source. They are great resources to use, like whether your whether your nipple drinkers or your individual galvanized water fountains. Remember, they're great, like they can keep most of the pathogen out, but make sure they do require routine sanitation to minimize like the biofilm buildup, which is the very yucky, slimy layer that we can feel when we're washing the water bowl. Make sure to get rid of that as well. Feed spillage, I definitely don't want like additional feed to unnecessary wild birds or wildlife. They tend to also attract lots of rodents too. Have them properly stored. One of the common issue that I run into when I have clients that usually less than 10 birds, like would be anywhere one has like 1 to 10 birds. When most of the feed store, they have this bigger size bag of feed. So storing too much feed for a very long period of time, you got to be very mindful about moisture buildup, about stale feed like rancid fat or mycotoxin. If you see the birds like for some reason they don't like the feed anymore, or they're trying to eat something else, like that would be the first thing that I look into to see if the feed has gone bad. Do not share any open bags of feeds like between flock, would be very helpful. So going back to this case, it turned out it was just a simple bacterial eye infection in one bird, so it wasn't contagious. But the grower did all the things that she did, and to protect her flock and minimize a disease and again minimize the disease outbreak, even though it didn't come back as a contagious disease. So it's very important. Like I always tell clients, when you're in doubt, assume it is contagious unless proven otherwise. So my last case here, I call it small flock X, and it's a small flock family farm with 50 broilers. They are free range. They don't have any avian species on the premise, which is great. And at 40 days old, they started showing some respiratory symptoms, and they had an increased mortality over the 2 days period. And you can probably recognize some of the signs already, like birds that are having lethargy in this like hunch posture where the neck and tuck really close to their body, some open mouth breathing and conjunctivitis. And we did a postmortem examination, and it's hemorrhagic and has this blood clot. This is a trachea of the bird, and you see that big glob of blood right here. And it came back infectious disease, infectious laryngotracheitis, which is a herpesvirus. We call ILT sometimes, that is very highly contagious and can spread through aerosols, so any kind of dust a liquid droplet can help spread over a very long distance. So further investigation, we found that this particular flock was located next to a commercial broiler farm that was diagnosed with IoT in a week prior to. And for those of you who, I know that we're talking about Yukon, you guys are way more luckier in compared to where we are. I'm located in Abbotsford, the Fraser Valley. You guys, poultry density is probably way less than what we see. But for those of you who never been to Fraser Valley, this is a picture of what it looks like. It's a satellite image from Google Map. And this is only a 4-kilometer stretch near the Abbotsford Airport, but you can see all these green circles. They are commercial poultry farms, and among them, there are probably a limited number of small flock, like backyard poultry in the area too. So basically, we're just a single farm. It's very, very difficult to practice like biosecurity in some circumstances. So this is why I want to emphasize that biosecurity, it's really a team effort. It's not only important to practice on your premise, but it's also very crucial to know your neighbors, know who they are, what birds they have, what's their history, and work with them very closely, especially during time of high risk activity. So not only in cases of disease outbreak, especially during like when flocks are shipping out, when people are cleaning out barns, there are higher risks of spreading manures and also the pathogens inside of manures to your neighbors too. Windy days oftentimes are more busy after than a windy day because some diseases can be spread through aerosol, as I mentioned. So develop a very good relationship with your neighbor. Just like, I have a neighborhood block watch where I live, like to report suspicious activity. But the same concept applies to poultry as well. So if you have next door neighbor, for example, if you have a next door neighbor that has more birds than usual, for example, over 100 birds, and maybe ask question, when are you shipping out when you are cleaning out the barn? Maybe during that time, I'll keep my pet bird indoor, or I'll put them further away, like from your premise, to minimize the risk of catching like contagious diseases. So those would be some of the good information to get working as a group. And going back to this particular case, 1 week later, this IoT case owner, she called me again, and she said that the IoT case positive broilers, they were slaughtered already, and the coop was clean and disinfected, and they were able to do it within a day. And they bought some neo-layer pullets and they put them on the same coop. And unfortunately, very shortly, the new birds started to show similar symptoms within a week. So we asked like more questions of the cleaning and disinfecting protocol and made a visit to the farm. And this is what we found on the wall that was supposed to be cleaned and disinfected like thoroughly. So I circle the two back circle here. These are actually, if you remember, actually the blood clots. Like remember IoT, they can generate a lot of blood clots in their trachea. So the birds were actually sneezing some blood on the wall. So don't forget about, it's not only about taking the floor area, but with thorough cleaning and disinfection should include all the surfaces, like even your fan, like your ceilings, your wall. Don't forget about them, because especially organic matters like blood, they can carry the pathogens for a very, very long time. I'm going to spend maybe a minute or two talking about thorough cleaning and sanitation. One of the most common questions that I get from my practice is what type of disinfectant, what detergent, like what's the brand name, what class like should I use? Before I even answer that question, we should go back to the fundamental basic, which is the proper cleaning and disinfection steps. I'm not going to go through every single steps here, because I know there's actually lots of good resources already that you can find online in terms of like the step-by-step, like how to walk you through the proper C&D of your farm. But I want to emphasize 3 key points. The first one is dry cleaning. This is very important, and this should be I would say 50%, at least 50% of your effort. So that's removing all your organic matters from the flock. So this includes manure that you see from this feed pens here, feathers and droppings, spillover feed, mortalities, obviously. If you are not completely removing all these organic matters, no matter which class of disinfectant detergent you use, it's not going to work to 100%. All these organic matters, they're going to compromise and deactivate all the disinfectant. So spend at least 50%. That's your elbow grease, like on removing all the organic matters. And then detergent rinsing, those would be the next step. And then I want to emphasize 2 drying processes. So the first one is the drying after you rinse out your soap and detergent, after the dry clean, before you apply this disinfectant. If you're not doing it, this important step, you actually think about it, you're actually adding disinfectant in more water, which you're going to dilute your disinfectant. So if it is practical, if there's enough time, leave a drying time in between before you start your disinfectant application. The next one that's very important is the drying after your disinfectant has been applied. Make sure it has like completely dry, and this allows some downtime before the bird's being put back. I have seen cases where it's not completely dry and client put litter, put shavings, like put straw back on the floor. And of course, like with humidity, that is a very great environment for bacteria, for mites, like for lice to develop, and also increase the risk of ammonia buildup, which can compromise the respiratory tract and the cornea of the birds. And going back to, coop design, so having a very easy surface material during your build, when you're thinking about your building design, can be very helpful in the long term. Oftentimes it's more expensive, but in the long run, it will make your life way easier in terms of cleaning and disinfection. So the pictures on the left here, I don't think I need to explain too much, like very cleaned. They painted the surface like with water proof material, and it's very easy to clean out, versus on the right side they're wood, very difficult to completely disinfect. So I hope by now you understand what biosecurity is. It's not only one thing, it's multidimensional. There's no one sentence that I can really put biosecurity in a definition. It's the procedures, their rules, there lots of educations involved, lots of routine, lots of protocols, and it does changes from time to time. It's very dynamic, depend on the disease condition, depends on what's going on like out there, well, new neighbors, new species of bird, new flock of birds, like different breeds, and ultimately I think it comes down to to one's attitude, like how determined you are to protect your flock. And it's the same thing. I always like this analogy, how it's like our home security system. We are not only relying on one resource, like there's so many resources that we can rely on and put them together and build a good biosecurity plan for your flock. And I know my house is very different from yours. My neighborhood is very different from where you are. So biosecurity should be very dynamic and kind of tailor-made to what your own needs are. So my take-home message is small flock has a lot of fun. I know I talk about a couple of scary cases, but please don't be discouraged. Every disease outbreak is a very valuable learning lesson. And establish your flock biosecurity protocol. So make it practical for your flock. I like to use a checklist. That's very helpful. Have a plan that's prepared. For example, have an isolation or hospitalization area ready. It's kind of like an earthquake kit or emergency kit that you go to when something happened. Work as a team, stay up to date. I can see the Yukon government has lots of great available resources. So when in doubt, make a contact with your local veterinarians. And I am going to end with this very great resource. This is called Small Flock Poultry Health Manual, and this is a comprehensive small flock health manual that covers all the basics. So housing, common diseases. They have a really great biosecurity section too that has more individual points about biosecurity and some more resources that are very helpful. If you can copy the link, copy this. Remember this magic word on Google keyword search, Small Flock Poultry Health Manual. This should be the first one that come up on your screen. It's a PDF document that you can save on your computer or print it out. And that's it. And thank you very much again for having me. And I look forward to the question and answer section.